Welcome, and thank you everyone for joining us today on our second COVID Town Hall. I'm Assemblymember Alex Lee, and I proudly represent the 25th Assembly District in the state legislature. 25th District includes both Alameda County and Santa Clara County, including the cities of Fremont, Newark, Milpitas, North San Jose, and Santa Clara. I know many of us have COVID fatigue at this point, after nearly a year and a half now, but there's a lot of new information about the variants, booster shots, and what return to work might look like. So I figured we should put together some of our experts together today and talk about all the new information that's coming out and get your questions answered. And with the news about variants like Delta, Lambda, and Nu, how is that impacting our region and how are our guidelines going to change in the Bay Area? What does President Biden's recent announcement mean for the workplace? And who's eligible for the booster shots and when? That's just some of the questions I've heard literally just on the street talking to people. And to help answer some of those questions, I'm happy to be joined today by our very own Santa Clara County Supervisor Otto Lee, Alameda County Supervisor Richard Valle, and our Santa Clara County Deputy Public Health Officer Dr. George Hahn, and Alameda County Health Officer Dr. Nicholas Moss. I also want to note that if you want to share the information from this town hall with friends or family, or rewatch any part if you missed something, the recording will be posted to my website shortly after this event. So if you signed up via Zoom right now, you're going to be able to access that later on. And finally, before we get started, I just also wanted to acknowledge some of the local elected leaders and elected officials who are here with us today. And that list includes, our folks, Board Trustee President Chris Norwood from Milpitas Unified School District, School Board Trustee Diane Jones from Fremont Unified School District, Kathy Kimberlin from Supervisor David Hubbard's office, Supervisor Cheryl Jordan from Milpitas Unified School District, and Newark Mayor Alan Nagy. And just another note too is, if you have questions at any point during our presentations, feel free to use the Q&A chat at the bottom of Zoom or put in the chat function. Or if you're watching on Facebook or another streaming service right now, you can also leave those comments there. We're going to be answering questions near the end. So if you have anything that pops up to you, jumps out to you as a question, feel free to leave it question down for us. And with that, I'm going to turn it over to Supervisor Otto Lee.
Thank you very much, Assemblymember Alex Lee, as some has called my adopted son, for putting together this town hall on the COVID-19 updates. I'm truly excited to be here with all of you this evening, along with Assemblymember Lee and Supervisor Valle, to provide the most updated information we have on COVID-19 in our communities and help address some of the outstanding questions you may have. After Supervisor Valle provides his opening remarks, our Santa Clara County Deputy Public Health Officer, Dr. George Hahn, will walk us through the updated data and information for our county as of last Friday, September the 10th. Dr. Hahn will also provide an overview of our county's cases, variants, vaccinations, testing, contact tracing, and other additional resources that we have. The good news I could say today is that in Santa Clara County, we are proud to highlight the more than 87% of the residents age over 12 have at least one dose, and more than 82% of our residents are fully vaccinated. But certainly we cannot become complacent as in light of the active variants of Delta that we're seeing. We still need to continue sharing the proper COVID-19 information, following the health orders and advices, and encourage all our fellow unvaccinated community members to get vaccine, whether it's family members, workmates. It is safe and effective, providing good protection against hospitalization and death for you, and helps protect the people around you. As we have seen in so many states and counties, more than 90% of those who are now being hospitalized are those who are not vaccinated. And of course, there are also many who is dying from that as well. Therefore, it cannot be understated how important it is for people to get vaccinated as fast as possible. And the fact that there's still people around us that's not vaccinated is really absurd, because of the fact that there's no shortage of a vaccine these days. With that said, I would like to go ahead and pass it along onto my colleague from Alameda County, Supervisor Richard Valle.
Thank you, Supervisor Lee. I appreciate the introduction. Assemblymember Lee, thank you so much for convening the forum. Dr. Hahn and Dr. Moss from Alameda County those are the experts that we're all waiting to hear from. I just want to say that the outset of COVID in March of 2020, my office immediately began to convene meetings at the county jail. On a weekly basis, I've been entering the county jail where we house over 2,000 people because we were fearing any kind of outbreak in a large setting like the Alameda County Jail located out in Pleasanton. I will be continuing those meetings out at the jail. I will be going out this Friday. At those meetings with the jail staff, the Sheriff's Administration, Dr. Moss's staff, public health, we have other people, interested parties, public defenders, and the public at large who have access to Q&A sessions like these about the jail and the conditions at the jail. I'm personally available. I can enter the jail freely, but the rest of the public is prohibited from entering the jail. So those benefits have been tremendous for the families and friends of people who are incarcerated, who have lost touch with a lot of people incarcerated. Secondly, we convened almost immediately with the 4 cities, Fremont, Newark, Union City, and Hayward in my district. Elected officials meetings and Dr. Moss's staff on a weekly basis, and all the 4 hospitals in our district to talk about census data, outbreaks, etc. We discontinued those meetings just about a month and a half ago, but it looked like COVID was in check. And now of course, the Delta variant seems to be on the rise, and Dr. Moss can speak to that issue. Lastly, I want to say that there was a tremendous demand for PPE equipment from the community-based organizations, many of whom were directly dealing with people in our community. Fortunately, as I went out to the jail every week, I came back with a trunk full of materials that I dispersed to constituents in my district. And that proved to be extremely beneficial because a lot of the community-based organizations, as you all know, are running on very tight budgets, and they just didn't have the extra dollars to spend on those things. Last thing, I also speak to you as an employer. I'm sitting in my office in Union City. We employ 72 Teamster drivers and sorters at a recycling operation here in Union City. So as an employer, it's been really helpful for us to go into conversation and dialogue with the Teamsters Union about getting everybody vaccinated. I'm glad to report that out of 72 people, only 6 have refused to be vaccinated, and all 6 broke out with COVID. And the last one returned today back to work. All of the others that have been vaccinated have had no issues, no problems, and no serious health concerns. So I think that the conversation and dialogue with elected officials, labor, public health is critical to this conversation, as well as the public. And thank you very much. And I will pass it back to Supervisor Lee.
Thank you very much, Supervisor Valle. And right now, according to the run of the program, I think we're going to hand this over to the announcement from the Santa Clara County presentation of talking over the overview of our county variant cases, booster shot information, and the new safety information that we have. And we'll try to also share information on where, how, and when our constituents can get these 3rd booster shot as well. And on that note, I will go ahead and pass it over to our very own Santa Clara County Deputy Public Health Officer, Dr. George Han.
Thank you all. And this evening, I'll be presenting an update on COVID-19 in conjunction with Dr. Moss from Alameda County. So the first slide I have is our epi curve that's showing our cases in Santa Clara County over the last year and a half or so. You'll notice the large peak in the middle. That was our big winter surge. And over the summer, we had a surge as well due to the Delta variant. And that has appeared to have peaked. And so what that means is at this point, we have early indications that we may be past the worst of this summer surge and maybe looking forward to decreasing case counts in the near future. So early indications are good that this surge is starting to come down. This shows the case rates that we have in our county, and this just goes back a few months, but I think it illustrates our latest summer surge quite well. The top line is the case rate among those who are unvaccinated in Santa Clara County, and it stands currently at 50, which is just a little bit below its peak, which was around 64. But what's striking about this curve, this data, is that folks who were unvaccinated were much more likely to contract COVID than folks who were fully vaccinated. And you'll see that the fully vaccinated case rate is way down at the bottom at 9.1. So even though people who are fully vaccinated sometimes did get COVID, if you were unvaccinated, you got COVID, you were much more likely to get COVID. So again, I think it bears repeating that even though you can still get COVID if you're fully vaccinated, your chances of getting COVID are much less than if you never got the vaccine. And this slide shows the variant situation. So back when we started monitoring variants in the late winter, early spring, there were quite a number of them, and you see them listed in their Greek letter designations up at the top, the different columns, including Alpha, which was originally known as the UK variant. But then over the summer, the Delta variant really took over and outcompeted all of the other variants put together. And so, right now in California, we're standing at 98% or greater of the cases of COVID that we've sequenced are actually the Delta variant. And what that means is essentially, if you have COVID now, you almost certainly have the Delta variant. And this is important because Delta is more contagious than previous variants that we've seen in the past. And it's also important because what this tells us too is it indicates that we may be entering a little bit of a period of stability. Back in the spring, we had various variants coming in, coming out. There's a lot of change, but Delta has remained really steady for the last couple of months, and so far no other variant has entered the picture that has dislodged it from its dominant presence in both our community and nationally. As Supervisor Lee alluded to, we have a great vaccination rate in Santa Clara County. Almost 88% of of residents ages 12 and older have at least one dose, and 82% have completed their vaccination. This is either a single dose of Johnson & Johnson or 2 doses of the Moderna or Pfizer vaccines. And so that's really a testament, I think, to the huge amounts of effort by county staff, as well as many partners, getting, all of you getting the message out there that vaccines are safe and effective. And we've really reaped the benefit of that in our high vaccination rate. A little bit about boosters. So this is unfortunately a little bit confusing because it's still not settled what is going to happen with additional doses. In August, the federal government announced plans that they might begin offering booster shots as early as September 20th, but we're still waiting for kind of official word of exactly what will happen. A lot of processes need to occur before additional doses can be given out. And so, for example, the Food and Drug Administration has to meet and authorize it. The CDC's Advisory Committee on Immunization Practices also needs to review the data and make a recommendation. So part of the issue is we're not quite sure who the booster shot will be offered to, at least, in terms of what the rollout might be, because certainly it wouldn't be everyone all at once. And then the other reason this is a little confusing is because the FDA already authorized an additional shot, a 3rd dose, for people who have moderate or severely immunocompromised conditions. So, folks with cancer who are on chemotherapy, for example, belong to that relatively small group of maybe only 2 to 3% of people have that moderate or severe immunocompromising condition. So that has already been authorized, and thousands of people have taken advantage of that additional dose, which is not technically considered a booster. But for the larger population, which may include folks who are older or healthcare workers, we're still waiting to see exactly what will happen. But despite all of this uncertainty, we are preparing under the assumption that boosters could be authorized as early as September 20th, and that we anticipate being able to begin having doses within arms within 24 hours of that authorization. And here's just a list of all the different places in Santa Clara County you can get a vaccine. All these locations, including weekends and evenings and drive-up locations. But really the best place to visit to find out where you can be vaccinated is sccfreevax.org. And there's lots of appointment-based, you can make an appointment there. You can find free drop-in, and of course, these are all free resources to get vaccinated. We also operate county-operated mobile pop-ups in high-risk communities, and have been working with long-term care facilities as well as pharmacies and in-home vaccination program. And there'll be more in the next slide about the in-home. Yeah, there it is. We do offer an in-home vaccination program for individuals who can't leave their home to get vaccinated. And so there's the information about how to do that. And we also have a partnership with VTA Paratransit to offer free transportation to vaccine appointments. Testing has increased during this summer surge, and the good news is the county has kept up. We've expanded our testing capacity so that we could keep up with the demand for testing. Whenever there's more cases, that automatically means that more people need testing to make sure that their contacts, for example, their contacts or family members are interested in finding out if they have been infected. But since our capacity has expanded, we're doing good in terms of that. And because, as I mentioned, we've peaked in our case rates, number of cases, testing is actually starting to go down. And our positivity rate is also declining. So that is all early indicators of good news. I think an important note that we'd like to get the message out is about contact tracing. So we are sending out automated text messages whenever someone has tested positive for COVID. And so we'd like the community to know that if you receive a text message from this phone number, 23393, that is in fact the County of Santa Clara trying to reach you about either being a COVID case or being exposed to someone who has COVID. And that way you can respond, you can get information, get access to resources. We have heard that some people are reluctant perhaps, or they're worried that this text message could be spam or some kind of malicious intent from someone trying to take advantage of the pandemic. But that's why we're informing everyone where the number is coming from, so that you can verify. There's also a number you can call to verify that it is indeed public health that is trying to reach you. And here is kind of the list of resources that we offer for testing. To find a testing site, you can go to sccfreetest.org. As I mentioned, for vaccinations, sccfreevax.org. And then we also offer guidance on how to isolate and quarantine safely, and answer all your questions about, what should you do, how long should it be for, etc. And that's at sccstayhome.org. And there's phone numbers that you can call for support services in order to safely isolate or quarantine. There's a phone number here listed for businesses and workplaces as well. And of course, our general county COVID website, which offers a wealth of information. And that completes my portion of the presentation.
Thanks so much, Dr. Han. Now we'll go to Dr. Moss from Alameda County.
Thanks, Assemblymember Lee, Supervisor Lee, and Supervisor Valle. Glad to be here tonight. Also, it's a pleasure to be on the virtual panel here with Dr. Han. I think you'll hear some familiar notes in terms of what's happening in Alameda County compared to Santa Clara. So this is our daily case rate of COVID cases in Alameda County. This is just 2021, so it starts on January 1st and goes up until last week. And you can see that we had the same summer wave that just about everybody in the US had, and that it was not as bad in Alameda County as it was in Alameda County during the winter surge. So a similar pattern to what you saw in Santa Clara. And that has largely been true. The Bay Area has generally moved together in these waves. And we are steadily improving since about the middle of August. Next slide, please. And I think one area that people have been really interested in is children, especially with the return to school. So these are rates in children up to age 17. And here again, most age groups of kids did not see rates as high as they did at the worst period of our winter surge. The exception is the 5 to 11-year-olds who did see a little bit of higher rate, but we're also back in school getting tested at a higher rate. And of course, that's an unvaccinated age group. Needless, it may be obvious, but all of these groups now are declining in their case rates as the overall Delta wave eases in Alameda County. Next slide, please. So just briefly on variants, I think Dr. Han covered it well. We do get some information about variants for cases in Alameda County. It looks very much like that state data. And what this slide shows you is just that virtually all the specimens where we heard what variant was identified during the summer turned out to be Delta. And you say, oh, Dr. Moss, there's a few other colors in there, but actually most of those are Delta subtypes. So really that has been the story across really the entire country, that it's been the Delta wave. It's still COVID, and remember, part of the Delta wave was not just the transmissible virus itself, but also reopening, relaxing a lot of our restrictions, and even the masking restrictions temporarily. So that's certainly been a big part of the summer wave as well. Next slide, please. This is our hospitalization data. As we start to think about COVID being with us in some way or another for a long time, if not indefinitely, as it adapts to us and we adapt to it, one of the things that remains really important is how much it impacts our healthcare system, how much severe disease we have, people in the intensive care unit, of course, deaths. So this is our hospitalizations going back to January 1st. And again, you can see we were at about our healthcare impact, people in the hospital, people in the intensive care unit, was about half this summer as it was last winter. So not quite as bad as we saw during what remains our worst surge, the winter surge. And things are actually improving. This slide's already a week old, and I will tell you that all of these lines are moving in the right direction. Next slide, please. Vaccination progress. Well, it's always humbling to share the stage with Santa Clara County, who's done a wonderful job in vaccinating their community. We are at 76% of people over age 12 fully vaccinated in Alameda County. Maybe that doesn't sound so great after you heard from Santa Clara, but we're actually, I think, 5th out of 58 counties in California. So we're doing quite well, really, compared to the average, and frankly, compared to the US and the rest of the world. Very high rates of vaccination, almost 90% of people with at least one dose on board for the 12 and up group. Certainly still work to do in some communities and some populations, and that remains a priority for our COVID team in Alameda County. No need to read all the fine print here. This is just to say that we continue to sponsor vaccination clinics across Alameda County. The county-operated clinics serving just a portion of vaccine recipients in the county, a lot of vaccine going through the healthcare system and through pharmacies. But our priority has been the neighborhoods hardest hit, really throughout the county. And we continue to work to get those people who aren't yet vaccinated, also partnering with schools and school districts to work on those youngest eligible county residents to get them vaccinated. I'll put in the chat box a link to our vaccines webpage where you can get all kinds of information about getting vaccinated if you still need an appointment, or you can call our vaccine hotline number 510-208-4VAX, V-A-X. Next slide, please. Similar to Santa Clara, vaccination has had an impact. So these are the case rates in unvaccinated county residents during the summer wave. That's in that yellow line there. And then in blue is the rates among our fully vaccinated population. And you can see just much higher rates among unvaccinated residents as vaccinated residents. Next slide, please. And this is actually national data that speaks to that same question. Just came out from CDC on Friday. This is data collected during the Delta wave across the country. Vaccine reduced the risk of infection across the US by 5 times, reduced the risk of hospitalization by more than 10 times, and reduced the risk of death by more than 10 times. So absolutely the most important tool we have in protecting our communities, protecting people from severe disease, which will get us to that place where people just aren't filling our hospital beds, and start to let us put this in the rearview mirror. Next slide, please. So Dr. Hahn covered some of this. Just to comment that Alameda County's supported vaccine clinics will provide additional doses to immune-compromised residents who need access. We, of course, encourage people to check with their healthcare provider. Often people with these conditions are in care and can access vaccine that way as well. And still waiting for that federal guidance on immune-compromised people who received the Johnson & Johnson vaccine. Next slide. In terms of boosters, we are similarly planning for a range of possible booster recommendations from the federal government. And in terms of what our county-sponsored clinics, we're going to continue to focus on reaching unvaccinated residents as our top priority, but certainly also for our priority communities, want to make sure that recommended booster doses are available. And we're engaging with, well, I think it's important to note, Alameda County does not have its own healthcare delivery system. We're a little bit unlike several of our large neighbors. Our mass vaccination sites earlier in the pandemic were really partnerships with other large stakeholders. And so we're engaging in discussions on that. But nevertheless, we will continue to sponsor vaccine clinics for communities that need it most and step up our efforts to meet whatever the booster recommendations are. Next slide, please. And so all this talk about boosters, but of course, we still have a lot of people not yet vaccinated. And some people may be on the fence still because they're concerned about safety of vaccines. Well, not only were these, all of the US approved vaccines authorized or approved after large clinical trials, very large by medical standards, including a wide variety of participants. They showed the vaccines were both safe and effective, but really we have had a huge amount of real world experience since those vaccines were first authorized. We're talking about hundreds of millions of people just in the United States who have received these vaccines, and we know a lot about them. And they remain both highly effective, particularly against severe disease, but also very safe. People can certainly have side effects after vaccination, but they're usually mild and really part of the body's response to the vaccine, where it's building a defense against COVID infection. Serious reactions are rare, and the benefits of vaccination in terms of the risk of severe illness from COVID far outweigh any risks associated with getting the vaccine themselves. And importantly, we're learning more and more about both the impact of COVID on people who are pregnant and on and potentially adverse outcomes for their babies, and really COVID vaccines are recommended for people who are pregnant, who are breastfeeding, who are trying to become pregnant or might become pregnant. We have really not seen any evidence of any safety or fertility concerns with COVID vaccine recipients. Also, no long-term side effects have yet been observed. I know people have felt like, maybe they should wait to see what the long-term effects are. First of all, none have been observed so far, and really none are expected based on what we know from other vaccines and from how these vaccines work. So certainly safety monitoring is a priority. It's ongoing. There's quite a big operation to continue monitoring the safety of these vaccines. But I think really we know that these are not only do these vaccines work well to protect us against COVID, but also they remain very safe. I think that is my last slide.
Thank you so much, Dr. Moss. Excellent presentation. And thank you, Dr. Hahn, for that great presentation as well. I think I want to reiterate what Dr. Moss just said is, the risks of not getting the vaccine outweigh the actual risks of any perceived risk of getting the vaccine. And so we're going to do a Q&A session right now with Supervisor Otto Lee. So if you have any questions now, submit them in the Q&A function. Supervisor Lee will be doing the pre-submitted questions from people that register ahead of time, and I'm going to be doing more of the live questions. Just want to note that, definitely there is a lot of pressing questions out there, but there is also no need to be super rude in any of your comments. I will not be reading any of those ones, but if you have pressing questions, please do submit them, and I'll let Supervisor Otto Lee take the first one.
Thank you very much. So the first question that was previously submitted is as follows. How far apart should you take your flu shot and the booster shot? Question.
I'm happy to take that one. So you can take your flu shot whenever you normally get it, which we recommend to be in the fall. Generally, we say try to get your flu shot by Halloween, and the reason for that is because beginning in November, December is usually when the flu season begins. So you want to have your immunity kind of boosted before the flu season starts to hit. And there's no interaction with the COVID shot, so you don't have to worry about when you get the COVID shot and then when you get the flu shot. You can get it at the same time, you can get it at different times. That's all fine.
Great. And I have a question here from James in Newark. I'm taking classes that are being held live, but also wanted to know what are the chances of mandating virtual meetings again?
Well, I can take a crack at this, and speaking really for Alameda County, but I certainly wouldn't be surprised to hear this from others. So we've learned a lot about COVID, and we've learned a lot about how we can prevent it without taking these, such extreme measures in terms of physical distancing restrictions, things like that. And we also have a great tool for keeping people safe in the vaccine that has really allowed us to move on from that place of, mandating virtual meetings, things like that. I know people are still adjusting to this. We've had to cope with the summer wave. We're not out of the woods with COVID yet, but I think that we are at a place where we don't need to mandate those kinds of restrictions from a public health standpoint. Certainly, we've seen curveballs before with COVID, but I sure hope we don't see anything that puts us back in that place.
Well, thank you so much for those answers. Right before I get to some more of the live questions, I forgot to mention that Richard Santos, who's director on the Santa Clara Water District, is with us, as well as Eden Health District Board Member Marilyn Faraya. But here's a question that I've seen pop up quite a bit: is at what point will things quote unquote go back to normal? When is it that the pandemic will be over? What is the goal? What should we be looking for?
I'll start. Maybe George wants to chime in with his thoughts, because I think, you ask 5 health officers what they think, you might get 5 different answers. But really, we have COVID, coronaviruses let me back up. So we already have other types of coronaviruses, relatives of COVID, that circulate in our communities, cause the common cold, things like that.
Mhm.
COVID may very well be with us for years, if not forever. But over time, as we get more and more immunity in our communities, in particular from vaccination, these severe outcomes, people in the hospital, people with potentially disabling long COVID, those we really expect to see less and less. And so, whether that happens in the next, year, 6 months, it's hard to really predict. But I think we're going to get to a place where we just are not seeing tons of people in the hospital. Obviously, we're not there yet. And so in a lot of ways, what we're trying to do with the vaccine campaign is get to that place as soon as we can.
Yeah, I would agree with that. One of the hardest things about COVID is the fact that it is causing so many people still to land in the hospital or even die, particularly in communities that have lower vaccination rates. But still, even here in California, we're still seeing a significant amount of morbidity associated with COVID. And so with vaccination, that should come down. And it probably is true that the virus will be around with us for a long time, and so we are learning to live with it, and to do things in a safer manner, at least until sort of the effect of COVID isn't so extreme, right? We're trying to get down from this extreme effect of hospitalizations and deaths.
Absolutely. I just wanted to also iterate a question that I had also seen before is, in Alameda County and Santa Clara County, we are very lucky to have much higher than average vaccination rates. The local vaccination rates themselves do not indicate, as I understand, right, do not indicate that the pandemic is quote unquote over in that locality, right? Can you explain why that might be the case?
Well, we have, high vaccination rates among people 12 and up, but no vaccine yet for children, right? That's a big population. And I know early on we thought maybe kids don't get it easily, or they don't spread it easily, or they don't get severe disease. Well, they are less likely to get severe disease, but they certainly get it and can spread it. And so that right there is one reason why we're a ways away from, really high vaccination rates. And we have a lot of people who have not yet chosen to get vaccinated, even here in our highly vaccinated communities. And in Alameda County, it's approaching probably 200,000 people who could get vaccinated and haven't yet. And we are, we're kind of the front runners. So around the world, there's even more unvaccinated people. That gives COVID a chance to circulate and keep getting reintroduced even into our highly vaccinated communities. We've also seen that vaccinated people are really unlikely to get severe disease, but they can get COVID. And so really, until we get to much higher vaccination levels, not just here, but frankly, around the country and around the world, we are going to see these cycles continue.
Absolutely.
Thank you, Dr. Moss. And that's actually roll right into the next questions we have that ask, when will the vaccine be ready for the 5 to 11-year group?
Yeah, I'm not sure anyone really knows at this point. I think they're planning to submit data to the FDA soon for that age group, but it could be well into November or December. I think we're in a waiting game at this point. It's not going to be a long time away. We expect it to be sometime in the next few months, but unfortunately, it won't be like next month, for instance. I should mention one thing, that the fact that we're having to wait for this FDA authorization is yet another indication of how good and robust the vaccine approval process is. There are so many scientists and doctors who want to make sure that we're getting it right. I mean, we totally anticipate it to be approved and that it will be safe in children, but we really want to make sure it's safe and effective in this age group. Children are not just little adults. As a pediatrician, I can tell you that. And so, this, I think, is just yet another indication of how seriously our scientific and medical communities and the federal government are taking this responsibility for approving a vaccine.
Absolutely. There's a good question in here as well, and I think this is more applicable to perhaps Alameda County, but is there going to be a move towards using census tracts instead of zip codes when reporting on vaccination rates?
I think we have that on our dashboard. So if you go onto the Alameda County dashboard, and you scroll down, you will find a map. And on that map, there are different tabs that you can click on across the top of the map. And one of them is actually, it says, I think, Vax Tract, which is vaccination rates by census tract. So you can scroll over every census tract in the county and look at how many people are fully vaccinated and what that population percentage is.
Mm-hmm.
One other question just came up, ask about the 9 Bay Area counties and health officers working together to coordinate and monitor each county's responses. Are these 9 counties now still on the same page and this meeting still taking place?
So all across California, the health officers meet regularly with the state officials and in regional groups with each other to compare notes, talk about our understanding of the data. It's not really necessary. I think each jurisdiction is different. There's actually 13 in the Bay Area group, 13 health jurisdictions, not 9. Each jurisdiction is a little bit different. We have different populations, different healthcare resources, things like that. And so we don't, typically people do plan independently, but it's an opportunity to share, lessons learned, talk about the data, the published evidence, things like that. And occasionally it is helpful to, when there's broad agreement about something, to coordinate a message. For example, when we all felt that it was important to, or many of us felt it was important to require masks for everybody indoors during the Delta wave, that was a place where we could coordinate our efforts. But typically people reach those decisions independently based on the needs of their own county. Or I should say, or city in the case of Berkeley. We do have one city health jurisdiction in the Bay Area.
There's this question that came in too. If I am exposed to someone who tests positive for COVID, how long should I quarantine if I am fully vaccinated?
So I think in most circumstances, if you're not in a special population, we can go over what those would be. You actually would not need to quarantine as long as you didn't have any symptoms and you're fully vaccinated. So that is actually the good news about vaccination, is that even though it's not perfect in terms of preventing you from getting infected, it does significantly still reduce your chances of getting infected. But if you do have symptoms, then you would need to get tested and quarantined. So this only applies if you have been exposed and were not symptomatic. There are some special populations that this wouldn't apply, or that it would apply differently. And that certainly includes some healthcare settings and other residential sort of settings where, if you are a resident of, let's say, of a long-term care facility or a nursing home, that might not apply there because of the high risk of spread within a kind of a residential environment. I don't know, Dr. Moss, if you want to add to that.
I missed part of what you said, Dr. Hahn, my apologies.
No, just about that some people, the average person doesn't need to quarantine if they're vaccinated and not symptomatic, but like certain special populations do.
Yeah, I think that I would echo that. There are some specific settings where the rules are a little different, but for most people, most of the general public, if you're feeling good and you're vaccinated, there is a recommendation to get tested between day 3 and 5. And of course, here in the Bay Area, you'd be required to mask. In the rest of the country, there's a strong recommendation to mask up in that situation, but you don't actually have to quarantine if you're feeling well.
Here's a question that I've been getting from many folks who've been vaccinated, saying that, look, I've been vaccinated fully. Why do I still have to wear a mask?
Yeah, I think that really goes to what I was mentioning earlier, how what changed is when the Delta variant became the predominant variant. People who were fully vaccinated started to experience more infections. So it is true that the vaccine does not protect against infection against the Delta variant as it did for the previous variants, but it still protects significantly. So you're still more protected if you're vaccinated than if you were completely unvaccinated. So, but the fact that you can get infected with Delta in particular is the reason why wearing a mask is important, because the scientists found out that if you became infected with Delta, you were fully vaccinated, you could actually transmit it to someone else, even if the other person was vaccinated. And so for sort of the community safety, if everyone wore a mask, including people who are vaccinated, that really should help bring down transmission and spread of the virus.
And can I add to that? And the other thing is, because we have people who are unvaccinated kids, things like that, we really need to set a high bar in terms of protecting those people who just aren't protected yet and can't even get protected. So eventually we'll have enough people vaccinated that this will be less of a concern, but we're just not there yet.
Absolutely. I've heard it kind of described like it's a layers of security, right? The masking, the vaccination, social distancing are all working together comprehensively to it. It's not one is a silver bullet to other while this pandemic is still raging. And I really like that analogy. And I know in some terms, perhaps in the media, it gets oversimplified, saying if you just wore a mask or you just did this or you just did that, you would be safe. But it's really a continuum, and making sure you're taking all the precautions you have. And just like in life with other risks, right? We take as many safety measures as possible to prevent bad things from happening. And that's the same thing with having a mask and having a vaccine too.
Yeah, I think that's a really important point, that there are in the time that we're living now, there are actually not that many restrictions, right? Because we do have the vaccine, and so businesses and schools are open, work sites are open for on-site work, and we're now learning to live safer with the virus, and it's not like you would necessarily have to take every single of those precautions. So for example, when you have good ventilation, and you're outside, you often don't need to wear a mask, particularly if it's not in a crowded area, because being outside means that the virus can easily get carried away. And so we had to think about it as, like you said, layers, but thinking about which layers need to be implemented for what kind of activity that you're doing. And so for something like where you're kind of in a crowded indoor space, that would be a space where vaccination is very important. Testing or masking is paramount. Testing can be important. Limiting your time in that kind of space is important. And so, and then in other settings, you wouldn't necessarily have to do every single thing, because the risk might be less or whatever, depending on what the situation was. But that's why the basis for all of these layers, of course, is vaccination. That's the easiest, most important thing, because once you get vaccinated, you've already covered that first most important layer, and then from there you're kind of just adding on top of it.
Supervisor Valle, I saw you raise your hand. You want to add to this?
Yeah, just a question. As we enter the holiday season, fall and winter, we've seen what that did last year. Are we going to see a surge, not in COVID, but a surge in federal, state, and local, county level education as people jump on airplanes, drive to other destinations? Is there going to be a concerted effort to let people know that we can't let our guard down? Have you had those kinds of conversations amongst the governing agencies, including at the state level?
I think that's been happening, and it really started ramping up in other parts of the country. The the course has been different. And California really started ramping up in late spring. But I know, when we were looking at the lifting of the California blueprint restrictions and all that, and I think especially as this, you're right to point out that as this wave appears to be subsiding, we have some holidays and holiday travel and people moving indoors coming, and I think it points to the need to just keep reinforcing those messages, which is, COVID's still out there. There's still a risk, and particularly with traveling, people from one place going to another place, vice versa, all that, that can really contribute to the spread and reintroducing COVID into our communities, potentially new variants. So I think it has been going on, but certainly now is a good time to reinforce those messages.
There's a question just now that says, my daughter just got the vaccine today. She's not feeling well. Are these common symptoms?
Yes. It's very common when you get the vaccine within, 24 to 48 hours that you might feel a little bit warm, a little bit feverish, have some aches, have other mild symptoms. But the good news is that almost always subsides within 24 to 48 hours. And it's an indication really of your body's immune system coming online, and reacting to the vaccine so that it can get ready to, do battle with the actual virus when it gets exposed. So I actually kind of take that as a good sign that they may have some symptoms. Now, and I was just going to add that it is always possible that if you're really unlucky and you happen to get infected with COVID right before you got your vaccine, that maybe you also it's possible that you have COVID. But usually you would be able to tell that if your symptoms were more severe or they persisted, or if you lost your sense of taste or smell. The vaccine doesn't usually do that, for example.
Right, Dr. Han. So basically, that symptoms does not mean the person has COVID. All that means is that your immune system is doing well, fighting whatever is in the vaccine and training the system, right?
That's right.
Right. Thank you.
Thank you so much. I want to thank all our presenters today for so much. We're going to start wrapping up. There are a lot of questions that are coming and streaming constantly. So if you didn't get your question answered today, feel free to reach out to my office or any of our offices that are on here today to get you more information. I know there's a lot of talk and a lot of data out there, and a lot of us are trying to make sense of a lot of data out there. But really at the heart of it, I think we should be able to try to trust our experts on these, especially the ones that are in our own community. So definitely, if you still have questions about things and things you've been seeing, things you've been reading, feel free to contact our offices. But I'm going to start wrapping it up and let our guest presenters also give like their last remarks. So how about we'll start with Supervisor Richard Valle, if any last comments or thoughts.
The only thought is that as Dr. Moss and Dr. Han have stated, as we come to the holidays, let's really step up our campaign, public education and outreach. This is when we're the most vulnerable. So let's continue to spread the word and make a concerted effort. Hopefully the state is going to put some money into advertising and marketing on radio and television. Thank you very much for this opportunity. Thank you, gentlemen.
Thank you so much, Supervisor Valle. And now let's go to Supervisor Lee.
Yes, thank you. First of all, thank you for everyone who has joined us this evening and asking very, very good questions. My colleagues and I at the Santa Clara County, along with Dr. Han and Dr. Sarah Cody, are all very committed to doing everything we can, including collaborating with other elected officials, neighboring counties, to support these public health and ensure the right information get into your hands. It is true that with social media, there are so many things out there that's not accurate. And I am afraid to say that a lot of the stuff is attacking the trust of our healthcare system. At the end of the day, one thing I could tell you is that having been at the county now for almost a year, I could say that we're actually in very good hands right here in Santa Clara County, and right here in Alameda, Contra Costa, and the 9 Bay Area counties as well. So I really do believe that ultimately is by trusting what we are telling, the information out there, get vaccinated, wear your mask, doing those things that we've been talking for so long is how we could finally beat this COVID issues. And if you have any further questions, please, of course, do not hesitate to contact my office with our contact information provided in the presentation, along with our fellow elected officials as well. And our team will be more than happy to connect with you of any additional information that you may need. Thank you.
Thank you so much, Supervisor Lee. And I want to give any final comments for Dr. Moss, and then we'll do Dr. Han, and then we'll wrap up.
It's been a long pandemic. I know people are tired of it and thought maybe we were done some months ago, but we really have come a long way, particularly here in the Bay Area. I think showing the rest of the country and really the rest of the world how you can do this right. And so hang in there and get vaccinated.
Thanks so much, Dr. Moss. How about Dr. Han?
Yeah, I want to echo that and really thank all of you and the communities in which we live for really being with us this whole journey. And it has been long, but we've gotten great vaccination rates. We've gotten lots of folks adhering to the mask guidance. And it really, I think, makes a difference. And we've seen that borne out in our numbers. The Bay Area has done really, really quite well in comparison to a lot of places. And so we have a lot to be proud of. And I really want to thank everyone for doing their part. And we're all in this together.
Yeah, thank you everyone for doing your part, staying informed. And while there is a lot of misinformation, a lot of doubt out there, just remember that, we are really in good hands, just as Supervisor Lee's talked about. We are in great hands, especially in California, especially in the United States, where we're lucky to have an abundant supply of vaccines, where, the case in other even developed countries like in Europe, they're not in such a great place right now. So it is really, we have to really count our blessings right now and really be mindful of our neighbors, our friends, our family, because this pandemic is not just about our own singular health, our own singular choices, but that of everyone we come in contact with. We live in the 21st century where we come across people from all across the world, all different states and counties, and we're really blessed to have that. But that also means that, not just because we have high vaccination rates in our county, doesn't end just at the county line. People travel all over the place. And especially as Supervisor Valle talked about, as the holidays come, be super mindful of that. So do your part, mask up, get vaccinated, ask your friends to get vaccinated, and really make sure that we're making the right choices for not just ourselves, but for everyone around us, because really we have a collective response with each other. So thank you so much, everyone. Stay safe out there and be well. Thanks, everyone.